Now, this week is Coeliac Awareness Week, and according to a recent survey, 42% of those who have celiac disease received a misdiagnosis prior to a confirmed diagnosis.
We're joined now by Dr. Nicholas Kennedy from St James's Hospital for Coeliacs and Christine Carty, who was diagnosed as a celiac 9 years ago. Good morning to you both.
Morning.
Morning.
Christine, let me come to you first, because you were kind of 2 years in limbo without a diagnosis.
Absolutely.
So you were 23 when you were diagnosed. But can you take us back there to when you weren't sure what was going on? What kind of symptoms were you experiencing?
Well, Nick and I were just talking about that actually, that my symptoms were triggered by a bout of food poisoning. And then I just went into, I suppose, a very bad period of my life, really, that food became my enemy. You know, I was constantly feeling tired. On a night out, I'd have to go home at 11 o'clock at night and go straight to bed. I was having to sleep sitting up in bed. I had, I'd have diarrhea like all the time. I'd feel sick all the time. I'd never feel myself, and I lost 2 stone.
Wow. And your friends were completely baffled by the fact that you always seemed to be sick or hungover or
Absolutely.
affected badly by, a normal night out.
I mean, for want of a better word, I'd say my friends probably thought I was anorexic or bulimic because I was losing all this weight. I wasn't eating much because I couldn't feel like I could eat. I was always feeling full or feeling a bit sick. And for want of a better word, I'd say even people thought I was maybe attention seeking a little bit.
Okay.
They were like, "What's wrong with you? You're always sick all the time." And it's it never seemed to get better.
Were there particular types of foods that you're finding it particularly hard to digest?
Well, at the time, because I didn't know what was wrong or what were the triggers, so I was eating everything as normal, breakfast, lunch, dinner, having a glass of wine, that I didn't really know what was wrong, to the point that actually I cut alcohol out of my diet because I was going to the doctors and they were saying, "Oh, you're 22, 23, you're just hungover. Maybe you should just give up alcohol." So I actually gave up alcohol to make sure that wasn't a reason for people to think that I was sick.
Okay, once you got diagnosed and you knew what was wrong and what you needed to do, was it life-changing?
Oh, completely. I mean, Nick and I would say that maybe within a week I was almost like coming out of a fog. It was like life-changing. I had energy, I had bouts of energy. I was able to stay out like till 2 or 3 o'clock in the morning, for want of a better word. I was able to go back to playing sport. I was able to go back to university and do my second degree. I even took up my Gashka award. I did all these really positive things in my life, and all I had to do was basically look at my food. Now, I will admit, going into the supermarket was an absolute nightmare, because what would take normally 15, 20 minutes was now taking 2 hours, because you're reading all these labels going, is this going to make me sick, or is it going to trigger my illness? But life became much more positive.
And I suppose the more you do it, the more you educate yourself and the more savvy you become about
Absolutely.
food labelling and everything else.
And most people's diets is habitual, so you usually go in and you have, you do your fruit chop, you do your meat chop, you get maybe your yogurts or, this and the other. And also I would say it really encouraged me to go back to cooking and cooking at home and eating alternatives. And don't forget now, 9 years ago, the bread looked like it fell off the back of a truck, whereas nowadays the breads are incredible compared to back then. You've so many alternatives. You've got bagels, you've got wraps, so you can even find tortilla shells. So you can have a varied diet by avoiding wheat. But what I'd say to you is the most important thing is to just stay within your confines and make sure that you're healthy and eating properly.
Okay,
Nicholas Kennedy, can we bring you in here? The science bit. Celiac disease is what?
It's an autoimmune disease, and
which means what?
I was going to try and explain that. You're born with a genetic predisposition to autoimmunity, and celiac disease is one of a family of autoimmune conditions. And there are 70 genes that have been identified as increased in celiacs. Some of them are far more important than others in determining an autoimmune reaction, and some are much more linked to celiac disease and other autoimmune conditions. But if you take the single most important one, which is an HLA gene, HLA-DQ2 or DQ8, it's estimated that about 30% of the Irish population would have one or other of those, usually HLA-DQ2, but 98% of celiacs have HLA-DQ2. So you have to have a trigger to bring out the autoimmune process, and as we were discussing before we went on air, the usual trigger is something that increases gluten ingress into the bloodstream in the gut, which is where gluten is met by the body, if you like. And that would be a gastroenteritis. So celiac disease can be triggered at any age.
Yeah, you were saying that you diagnosed somebody in their 90s with it.
Yeah, the eldest person that I've come across was 92, and she was diagnosed because she got jaundiced and had a gallstone, in fact, stuck in her common bile duct, and the person who took that out...
Okay, good. Because of time, I'd like to fast forward you here. What happens when somebody has celiac and they have this gene, and then they introduce the gluten or the wheat into their system? What's going on in there? Why
do you react to it?
Well, yeah, and how severe can the reaction be?
Very different expression in different people. It can be practically no symptoms, and it may only be recurrent mild anemia that leads to the clue of diagnosis, or it can be, like Christine described, rather more severe with rapid weight loss and diarrhea and abdominal symptoms, which is a much more obvious pattern. But that's a so-called classical pattern of celiac disease, but the vast majority are not as symptomatic at all.
Is it progressive? Does it get worse as you get older?
It varies. It can. It goes up and down in severity in some people. If it's triggered with a gastrointestinal infection, usually the worst bit is soon after that infection, and it just keeps going at that level until gluten is removed. The issue really is that if you have damage because of your immune system fighting gluten, it can happen in the gut, but it can also happen in other parts of the body, and you can get antibody reactions against the gluten digesting enzymes in the skin, the nervous system. You can get joint problems, muscle problems, weakness. There are a lot of symptoms, and celiac disease is sometimes hard to think of if people present mainly with tiredness and a bit of anemia and maybe a bit aches and pains.
Well, of course, the first and most important thing is that you get an accurate diagnosis.
Absolutely.
Once you have that, then it is eminently treatable, and
Yes.
as you've said, there's no comparison between life now and before.
Absolutely. I mean, I went travelling with my fiance last year. I would never have done that without that. And I think actually celiac disease was one of my impetuses for living my life. And I live a full life. I have a well-rounded life. In fact, my friends say it's so hard to get hold of me sometimes because I'm doing this, that or the other. But
You look a picture of how. So it's about managing it carefully, Nicholas.
I think the first thing is that it has to be diagnosed, and a lot of people don't get diagnosed for too long because people don't think of it, and GPs and other doctors don't think of it as the possible reason.
Well, Nicholas, sorry to cut across you. That's the reason why you're here this morning, is because it is Coeliac Awareness Week. So now that you are thinking about it, I mean, your local chemist or local pharmacy will have some literature, some pamphlets on it, and if you feel that it may possibly be part of what's wrong with you, then go and check it out, and don't take no for an answer until you know exactly what it is. And when
Absolutely.
you do, all right. Listen, thank you very much indeed.
thank you for having us.
Thank you.
Summer
Right.
is always full.